Langi and Molo, thanks for taking time to visit with me and to share your experience in the healthcare system. If you don't mind, we can start off by you introducing who you are, um, a little bit about your background.
Okay, I'm Angie Fanua, Molo's wife. Been married almost 30 years now, and I'm originally from LA. But we're Utahns now. We've been here about the same time, 30 years in Utah.
Yeah, my name is Molo
Ulu.
and I'm here from Utah. Yeah, from LA, but I move out here to Utah 30 years now, like my
Okay,
wife said.
awesome. So you started out in LA and then you moved to Utah.
Yeah, well,
Um,
you're originally
Inglewood.
from Tonga.
Where? No.
He forgot that part.
all right. So how old were you when you moved from Tonga to Inglewood?
I was 9.
You were 9 years old. Okay.
Yeah, when I left.
So there might be some parts that you still remember about being in Tonga. Could you, Molo, could you help us describe some of your earliest experience with healthcare, or what, when you think of healthcare when you were a child, what did that look like to you?
When you were little.
Um,
Kami tupukoy ito now, like healthcare.
oh, the healthcare, yeah. When I was in my 20, 30, I didn't care about those things. As I get older, that's when
But he's
important for
he's
me
asking
to.
you when you were little.
When I was
If
little,
you
I don't.
remember anything growing up in
No,
Tonga.
no,
There was
I didn't.
no
Yeah,
there was no healthcare.
yeah, I didn't remember anything back home.
Okay.
So I got here when I was 9, and
So when you got to LA,
basically,
what did that look like? Did you
What
ever
about when you got to
go to the
LA?
hospital or visit with
Did you
the
ever have to go
doctor?
to the hospital or doctor visits?
oh no, back then it was when you get sick or something happened, then you go to hospital. It's not like nowadays. It's better for kids nowadays. They have appointment, they follow up and all those. Back in my time, we don't have those kind of things till you really get sick and then you go to healthcare and and but I survived it.
We all survive.
Yeah, I survived. I made it here now.
We made it through.
Yeah.
Is that the same thing for your parents? Is that something that you learned from your parents or from your family or your friends?
Yeah.
I think for my in-laws, I know my in-laws pretty well. I think it's to be expected, especially with those Tongan people, Bobs, that have that mentality that like, oh, we're not that sick. We don't have to go to the doctors. That's how my in-laws were when they moved in with us, because I was there. I would help take care of them and take them to appointments. They would not go unless they really had to. Like my mother-in-law, for example, even when she was in pain and I knew she was, she she did not care to go to the doctors. She would say she was fine, unless we had to force her in the car and then take her. And the same thing with my father-in-law. He was even more stubborn than my mother-in-law.
I so I can kind of understand that, and I saw that in my own family. What were what do you think the reasons were why they were so stubborn to go in?
Well, I think for one, because they probably didn't have the healthcare in Tonga. They still to this day, I don't think it's as the healthcare system is as awesome as it is here in the States. I mean, when we went to Tonga, I don't remember seeing any clinics around. And I mean, they only have, like in the main island, they only have, one hospital, and nobody wants to go to that hospital. Everybody's mortified to go to the hospital because that means you're going to die, right?
Okay.
So I think because they grew up and they didn't have that accessible to themselves, I think it just stuck with them when they were here in the States, even though they were here for a very long time. Um, you know, I don't know how Molo and his siblings were as far as if they needed to ever take mom and dad to the hospital. Um, I know my mother-in-law, she was diabetic, so I remember by then me and Molo were already married in LA, and I would go with her to a lot of her visits, and I also helped kind of change her eating habits because her diabetes was so severe. She was doing insulin shots and whatnot, and it got to the point where she got all better and stuff. Same thing with my father-in-law. He had a brain aneurysm that almost took his life. And like I said, I mean, literally, he almost died before he even went to a hospital. And, you know, he survived and stuff and had to do a lot of physical therapy to learn how to do everything all over again. And then
so,
lastly, you know, he had cancer as well. He had prostate cancer that he died from.
so when they went to the hospital, were they glad that they went to the hospital, or?
I'm sure they were. I'm sure
Yeah.
neither one of them was planning on dying anytime soon when that incident happened.
Yeah. Do you think they should have went in sooner?
Oh yeah, definitely. Definitely. I think that would have been better for both of them. My father-in-law's, just thinking as far as when we find out he had his cancer because he was stage 4. I did the yearly checkups and took him in when he wanted to go in, you know, if something bothered him. I made sure to make appointment because, like I said, I was, you know, like the one that was kind of like the to-go person, and like I would help translate and stuff. And it sometimes that I sometimes I think about it too, you know, like what went wrong, you know, how come they couldn't find the cancer before it got to stage 4, you know what I mean? What did I not do that we could have prevented from it getting that severe, you know, and ended up eventually taking his life.
Yeah.
Because I did all the yearly checkups and stuff, and so I don't know what went wrong in that part.
Is that a question that you still ask yourself today?
No, occasionally when I think about it, like it was just his 6 or 7 year anniversary when he passed, and you know, sometimes it's in the back of my mind.
Yeah. Do you think that was something that was done wrong by maybe the provider or the doctor that was seeing him?
I kind of think it, because if we're doing yearly physicals, you know, you think about what they're checking and what they didn't check to have caught it on early. You know, because I was on top of it.
Right. So maybe different questions. Maybe you didn't understand what the doctor was saying. Is that a possibility, or do you feel like you did everything that the doctor asked you to do?
No, I think what it was is more that Grandpa wasn't really telling me everything he needed to tell me.
Okay.
Because, you know, that Tonga mentality, you know, that, oh, I'm fine, I'm gonna be fine. I know that there was symptoms, but I think sometimes he didn't either burden or bother me and Molo about it.
Okay.
So he just kept it to himself.
Yeah. So how do you think that has impacted you? You know, how has that changed you? How, you know, do you want to go to the doctor because of what happened?
Yeah, I mean, you know, mother of 10 kids. I mean, even to this day, you know, I just did the last of the babies of 4, you know, I'm on top of, you know, doing their every 3 months dental visits. Always kept them updated with their immunizations. I mean, like I kept my flock close, you know, I always made sure that I always took them when they're sick, even if I had doubts, you know, I always thought it was better to be safe than sorry. That's something that my mom did with me because, you know, we are here from the States, you know. Whereas this one, you know, sometimes I know that I've told him, man, the baby is, you know, not doing well or something's wrong. And he's like, oh, let's just find out where they'll be okay. And it's like, you know, our mom intuitions are never wrong. And it's like, no, give me the keys. I'm going to the emergency. You can stay home with the rest of the kids. You know, they're going to be okay. They'll be fine. Bye.
So let me help explain for the people who will watch this video what you just said.
Okay.
Because I don't think they'll understand what you just said. So
Yeah.
Your mentality was, hey, let's take this sick child to the hospital. Let's get them taken care of. Let's have the doctor see them. Molo's response was, no, let's do whaingawe. And what that means is let's give this child a blessing. That they'll be fine. Yeah, and they'll be fine, right?
Yep.
So that's something I wanted to just a distinction I wanted to make for our audience. So
Yeah. Okay.
thanks for sharing that with us, Angie. I think
Okay.
that's really insightful and really helpful for us to understand what the experience or what the attitude of someone who's out in the community, maybe a Pacific Islander or someone who's disadvantaged or might not have the same access to healthcare, what their attitude might be.
Okay.
We might think of alternative or different options that you might consider or think about before escalating it up to going to the hospital.
Well, I mean that has come about in throughout our married lives. So don't get me wrong.
Yeah,
We've done the Tongan Faita'o,
that's the Tongan
for
medic.
myself as well as the kids. And then then go to the doctors because nothing's no home remedies are helping. Um, but I think just for me myself, as being born in the States, and like I said, my mom did her best, even though she was a single parent of three of us, that when we were sick, to go to the doctors and get it taken care of. Per se, this one, that they really didn't have that accessible to them back in the islands.
Okay. And so, Molo, you know how you grew up, and you know how you think about doctors or going to the hospital. What do you think about it now? Thinking about it, you know, in the past few months or the past few years. How has your attitude changed, or what are some of your feelings about the
Um,
hospital or doctors?
Now every little thing, now I gotta go see the doctor now.
Your
Yeah,
mentality has
melody
changed.
changed. After what happened to me, everything changed, because I done it before, and then I did it before I got sick. I went to the doctor and they sells me something else.
Then,
You
well,
know,
so after Dad died,
yeah, we went
that
in
prostate, obviously, it
check.
goes down to their children, right? And so we went in actually
Check,
several
yeah,
times to see if he can get checked earlier than later because of the same reason
yeah.
that his father had passed from it. And we were also told
You have to be
initially
50,
that he had to wait till he was
50.
50,
Yeah.
50 years
I
old.
went when I was 48,
And
and they told me you can't go.
we went
And I got
several
sick when I was
times. Yeah,
48.
we
I
went
didn't know.
several times to say, hey, he's having
Yeah, my dad have it.
issues
So,
with going to the restroom, and he's got discomfort and
and they
all the
say
symptoms.
it's hernia. When I get,
They
what is
just
it?
kept saying different things.
Yeah, they
Um,
tell me it's that. But when I sit there for another 6 months, and that's when it got too late, and get to what
when
stage 3. But I
yeah,
went in for the same thing for like a month or a year before that.
well, I'm gonna backtrack more of what he said though, but because I think what happened as well was that when they finally actually said, okay, we're gonna check him for the prostate. Um, that was, I think, the first year that we actually were able to get a health insurance through the marketplace, which is another sucky thing. Whereas before we had health insurance through Medicaid, but because of income, blah blah blah. The clinic that we were going to was not a. I mean, it was a clinic. It is what it is. Um, but when they finally were like, okay, let's do a prostate exam. I think what happened was when they did that prostate exam, they actually felt it, which leads me to believe that it actually was the tumor that he had when we found out that he actually had the cancer and not the prostate. You know what I'm saying?
Interesting.
And so that prompted them to send us to a specialist to do a colonoscopy. And I mean, that very same day, after
But that's like 6 months later
after
or a year
after
later.
the specialist,
Well, we tell them there's blood in my
urine,
urine. Yeah.
the guy that did the colonoscopy, the doctor, I don't know what they call him, but he comes in and he very blatant said, there's no other way around this. You have a tumor size of a grapefruit, yada yada, and it can be cancerous. like my life just crashed. Because, you know, here is a second family member, you know, on my husband's side with cancer again. Did the yearly checkups, did, you know, everything when we were pressing and pressing for the doctors to check him for the prostate, even though it was, you know, different type of cancer. I kind of felt like we were at the same situation when my father was diagnosed. My father-in-law was diagnosed. And so I remember leaving that day from the doctors and him being happy because he did, you know, the doctor said that he didn't think that it was too advanced, that they can probably take care of him and probably help him cure him. And I'm like, he's dying. I'm crying like, oh, he's gonna die right now. Like, you know what I mean? And we're in the elevator and he's like, couldn't understand why I'm crying. And I says, first your dad, now you. And why are you happy, you know, that you have cancer? Like, it's nothing to be happy about. I'm gonna lose you. We lost your dad and now you. And you know, for him, when we finally did find out that it was stage 3 colorectal cancer, he was still too, he was like, okay, as long as you believe that I'm gonna have a chance that you can cure me, let's go for it. Let's do whatever we need to do. As soon as you, like, we can do it today. Like, we can get started today. And I'm just looking at him like he didn't even let me process or nothing. I'm just looking at him like, can we talk about this, doctor? Can we get back to you? And he's just like, let's go. Because he felt so prompted, you know. He didn't want to have to wait. He was ready to go, and whatever the outcome was, he didn't care. He just agreed with everything the doctors told him to do. And I was more reserved just because of the experience with my father-in-law. So, I mean, it's almost like it was a double whammy because it, you know, it happened with my father-in-law where by the time we went, it was too late. And I mean, he's actually a living testimony. It wasn't too late because August was his last official surgery where they ended up just removing his rectum and he got a permanent ostomy.
Took my toe too.
No, they didn't. He's lying. And, you know, the sucky part is that he has a permanent ostomy, but he's, you know, he's thriving. We just did a CAT scan not too long ago, and they've extended it now instead of 3 months to 6 months because he's doing so well.
Awesome.
Yeah.
And the CAT scan came back and it looked even better than the last time. So there is a hope at the end of the tunnel, per se.
Mm-hmm. Hey, that's great. Thanks, Angie, and thanks, Mola, for sharing your story. This is very personal, you know, and private.
Yeah.
You know, and I really appreciate you sharing that with me.
Okay.
As you're sharing that with me, Angie, I thought it was interesting how you guys flipped. First, it was Angie who wanted to go to the doctor, and Mola was, you know, let's pull the brake. You know, hold up.
I guess because it had to do with him, huh? It took for the cancer to come and bite him in the butt.
It's just the kids, never mind, huh? No, that's awesome. I'm glad you're getting the treatment and the care and the attention that you need, Mola, and
yeah,
you know, and it's unfortunate they didn't catch it when you first complained, but I'm glad that they eventually did.
Yeah, Huntsman has been awesome. I love that hospital.
Yeah,
nothing but good vibes. I'm so grateful that we actually have that hospital here in Utah. Yeah, nothing but awesome.
That's so great to hear. What is it that makes Huntsman awesome? I mean, I am biased.
From the parking people that park your car for you to the staff people, you know, and the nurses. I mean, you know, he did both chemo and radiation, and I think once they actually got to know us, because, you know, he went through his chemo and radiation and several surgeries. It took us almost 2.5 years. And they got to know us really well. And we can probably both be jokesters, even though Molo is a little bit more of a jokester than I am. I mean, all we can do is grin and bear it, right? And so I think that made it a little bit more like you can swallow the situation more better, per se, when you have people that you can actually joke and make fun of with his, you know, because I remember when he was doing his radiation and when he finished, I couldn't go in with him, obviously. So I mean, I would sit in the waiting room for hours, and then he would come out, right? And the nurse would come, and he's like, yeah, he was like the butt of all jokes. And or like I remember when he officially finished his radiation, they're like, we're gonna miss seeing your bums so much, and just things like that. That shows that they actually do care, even though we joke like that. But that was kind of how we were interpreted, and so they
Yeah.
knew that it was okay for them to be like that back to us, and so that was comforting, because I think a lot of the times for me when I kind of felt like, oh my gosh, like he's not getting better, or oh my god, he's not going to be in the hospital again, because he had a lot of times where I think one of my breaking points was when he got sorry.
Okay.
I didn't mean to start
Dude,
crying. I'm all emotional thinking about it. No, this guy, I mean, he's a troublemaker. He's always, that's what I called him every time we went into the Huntsman. He's a troublemaker. And so, he would get there and the nurses would just even clown to, troublemakers here. But I remember one time we took him to the emergency and he ended up getting really sick because everything was backing up in his system. So he got that sepsis shock. And I mean, he was in trouble. So I'm like, okay. And I'm telling him, you have to get better. Like, the cancer didn't kill you. This better not kill you. Like, you better, I'm like, okay, what's going to happen? What's going to happen? And the nurses just were so lovable. Stop. I mean, they were like part of the family,
Right. Well, thank you, Angie, for sharing that. I'm so glad that, and so proud of you too. I know it's a really difficult journey that you're walking, and
I just hope to God that we keep pressing forward and we don't have to go back to the Huntsman, as much as I love the people there.
Right.
I don't want to go back.
Yeah, and we want the same thing for you. As much as we love you, we want you to be at home and be with each other, doing the things that you love and enjoy.
Yep.
And I think that's one of the benefits of us holding these type of interviews and having, real patients share real experiences, is that we get to understand who you are and meet you at the level that you are at. And I hope that through these type of activities that we're able to improve. It's kind of hard to get better from being awesome, as you said, but that's something that we want to do. We want to get better.
Awesome.
We're not going to stop. We strive for excellence, and I'm so glad that that's what your experience has been.
Oh yeah. The only thing I regret not doing was going to the acupuncturing and all those fun stuff that they have in that one room. I never had the time. This guy never gave me the luxury of having me time while we were there stuck for so many times when he was in and out of the hospital. Or the meditation room or the yoga, whatever they were having. I think I only went to once, and it was when he was pretty much already done with everything. They did like what do they call it? It was like a group for like the care providers for the people that are sick. I only got to go to one of those sessions, and everybody kind of shared their experiences and what they were going through and dealing with. And when I went, like I said, we was pretty much done. And so I wish that I would have known about those what is it like?
They're little workshops, or like for healthy living.
I wish that I could have went to those from the get-go. I think it would have relieved a lot of stress for me and a lot of restless nights. Okay. If I would have had it earlier than just at one time, I think I would have connected with other people that were going through what I was going through, and that I could have probably called call someone late at night when I was having, like a time, I wish I could have, that would have been there from the get-go, that I knew about it. Or don't get me wrong, I had a lot of social workers that reached out, and it got so much that I couldn't remember what social worker was what, and from what department. Because they always wanted to make sure that financially we were okay, or that our health insurance covered everything, yada yada. But they were awesome too, the social workers. They were really good on responding back to me and letting me know, how to maneuver the resources in the community as well. But that one session, oh, I wish I could have done it sooner because it was awesome. There was only maybe like 6 of us in there, but I think by the time we were done, we were all just crying and hugging each other. You know what I mean?
Yeah.
And sometimes just that human touch is all that you need.
I love that. Do you think that was that because they didn't tell you, or maybe they told you at the first and there was so much information you forgot?
I think a little bit of both. I think probably more, like I said, Molos, they treated him very aggressively, so I didn't really have a lot of me time to be part of that. And they might have told me, and maybe I just didn't register. I don't know.
Well, that's good feedback. Maybe we can do it throughout the treatment, not just at the beginning, but, throughout and say, hey, are you taking care of it?
I'm a talkable person, as you can tell. I mean, that's just me. I've always been like this, I'm more talkative. Yeah. That's why he has a secretary. But like I said, it's nothing like talking with other people, and it doesn't matter if you know them or not. I just, like I said, generally believe, that human, one-on-one or contact, not even contact, just talking with one another, sharing similar experiences, even though one person might, have a totally opposite cancer than what my husband had. We're in the same boat, because we were all in the same hospital being treated, our significant others were being treated, and, we were there for each other.
Oh, that's so awesome. I can tell that you guys are a great team and that you work together. And I think that does wonders for healthcare, for our outcomes, that helps us, hopefully get better treatment, and, the results are a lot better when we work together. And I love seeing that from the both of you.
No, thank you, Andrew.
Yeah, and I really appreciate your time today. You've shared with us a lot of great information. And I think we're in a place where we can take this information and incorporate it into what we do, as a hospital, as a healthcare system, and in that way we can provide better care for other patients. So
awesome.
Really appreciate your time and what you've done for us today.
Oh, no worries. It's our pleasure.
Yeah.
Like I said, it's not like we have anywhere to go. We're stuck at home, so.
Yeah. Well, I'm glad that you could spend it together with me. So thanks.